And that love from coast to coast, and planting them seeds so you know we growing, believing in us, damn right we know when. Ain't got time for the stress and pain, no time for hate, no time for games. It's time to take it up, take it up, we gon' take it up. Hey.
Real talk for real life. Real talk for real life. Real talk for real life. Welcome, guys, to Real Talk for Real Life, guys. My name is Sherri Ann Duncan, and I will be your host today. Listen, I am so excited. We have a special guest. Her name is Miss Lisa Saintil. She's an advanced practice nurse practitioner, and listen, she is here to provide some invaluable information regarding breast cancer and breast cancer awareness. This is October, and this is the month that we recognize breast cancer awareness. And what better than to have Miss Lisa Saintil come on this platform and just give us some jewels and some nuggets that we'll be able to take away to share with our family members and our friends. So, Lisa, thank you so much for being here today with us. Lisa, go ahead and introduce yourself.
Thank you, Sherri. Thank you for having me. Yes, my name is Lisa Saintil. I am a board-certified family nurse practitioner. I am also a certified genetic risk assessment specialist, and I've been in healthcare for over 15 years now, 16 years in a capacity as a registered nurse and working as a nurse practitioner. My current focus in my career is geared towards oncology, cancer patients, and more specifically, patients with a known hereditary cancer risk or a positive gene mutation. So both affected persons along with people who come from a strong family history of cancer. So thank you for having me.
Okay, and thank you for accepting the invitation once again. You were with us last year, and so when you said yes this year, I was like, oh, yes, thank you so much, because definitely I know that you're going to be able to advise our audience regarding breast cancer and some of the ways that we can go about preventing and some of the ways that we can go about managing if that diagnosis is ever given to us or someone who we know and love. I just wanted to go over a couple statistics that I actually researched myself. I'm coming from an American Cancer Society, which is a reputable source. In 2024, it is estimated that among women that there will be 310,720 new cases. This is quite a few women that will be diagnosed. And also, I want the public and I want the audience to understand too as well that men are affected, and they're stating that there will be 2,790 new cases affecting men. So this is coming from, again, the American Cancer Society. So we know this is a reputable source. So again, this is why it's so vital that we talk about breast cancer awareness. And not just in October, right, Lisa? I think that's something that we need to stress, that we shouldn't just recognize it in October, because as an advanced practice nurse practitioner like yourself that deals with this on a daily basis, how important is it that we bring this subject to light more than just in October?
It's very important. We're grateful that October is definitely dedicated for breast cancer awareness, but breast cancer is really a 365 days a year disease that we're encountering. So men and women alike are receiving their diagnosis of cancer, not just in October, but literally every single day throughout the year, they're receiving or someone is receiving a diagnosis of breast cancer.
Wow. All right. So that's why we're here. Let's go ahead and get into the topic, Lisa. So for those who don't know what breast cancer is, can you explain or give us a definition of what exactly breast cancer is?
So breast cancer is nothing more than an overgrowth of cells. So an overgrowth, a multiplication of cells within the breast tissue. And sometimes this may spread out into areas such as under the armpit, which can lead to a formation of a mass or of a lump.
All right. So once this is detected, what should someone do once they feel a lump or something abnormal or see some swelling or maybe may see some discharge coming? So what should they do at this point?
Most important is to notify your healthcare provider. So for each individual, a healthcare provider might be their physician or their doctor. It may be a advanced practice nurse practitioner. It may be their gynecologist. But once one detects on their own that, hey, I feel something there or something is abnormal, as you just stated, it is very important not to wait too long and to bring that to the attention of their healthcare provider so then they can go through the process of a workup.
Okay, understood. So, what are some of the common signs and symptoms we as women and men should be looking out for?
So that's the tricky thing, Sherri. When it comes to breast cancer, especially small breast cancer, there's really no sign or symptoms. That's why mammograms are very useful. Mammograms are used to help us detect breast cancer at its earliest state. So the state where you don't necessarily have symptoms, you don't necessarily feel a lump or a mass. But for more common signs and symptoms, I would say a lump or a mass within the breast. This lump or mass can also be identified under the armpit, breast pain, breast discomfort, nipple discharge, also changes within the skin of your breast. So maybe a little bit of a thickening, also resembling that of an orange peel, just to name a few as far as most common signs or symptoms that a woman or a man may report.
Okay, I'm so glad you touched on the fact that sometimes there may not be any symptoms, and this is why we have to do our yearly mammograms. And so let's get into that. I think that is very critical too that we discuss. When should women start with mammograms? And then I also want to touch on just doing your manual breast self-exams. When should we be doing that as well?
Right. So when it comes to the self-breast exam on oneself, this is something that I feel like lately we just haven't been hearing much about it, right? But that also plays a very crucial part when it comes to early detection of breast cancer. So typically what's recommended is when a woman has formation of her breast. So typically by age 18, most women have reached the age of puberty and have full breasts, that at least once a month that she performs a self breast exam on herself. Now, typically this will be recommended to be done about 5 to 7 days after the end of one's menstrual cycle to go ahead and do that. Now, specifically regarding breast cancer screening using mammography or a mammogram. Now, the age to start for the average woman, and when I say the average woman, that would be a woman who has average risk for breast cancer. So not someone who, let's say, has a strong family history of breast cancer or who has a known genetic mutation that puts her at an elevated risk. That would be a separate conversation. So a woman of average risk, she should start her mammogram at age 40. And this should be repeated on an annual basis. So beginning at age 40 and every year thereafter.
Okay. So for the woman that does have family history, what would be the difference?
So when it comes to a woman who has family history or a woman who is considered to be at high risk for developing breast cancer, I want to touch and elaborate a little bit more about what high risk may mean. So high risk would be that woman who either has strong family history of breast cancer where multiple women and the family have been diagnosed with breast cancer, especially if you have at least one of those females being diagnosed before the age of 50, any close family history of ovarian cancer, or even a male breast cancer. Now, there's various tools or models that can be used in order to assess this woman's risk of breast cancer. And typically, if a woman scores above 20%, she's considered high risk. And so typically, in that example, a woman would be recommended to start breast cancer screening at age 30. And for the most part, a mammogram along with a breast MRI is what will be considered her screening protocol on an annual basis. And it all just varies, of course, precisely to one's family history and any other extenuating circumstances that may lead her to be at high risk.
And again, Lisa, because I do have family history of breast cancer, when I first started my mammograms, I was actually 35. It was recommended to me at 35, but see, I hear you saying 30, so things have changed. And so this is the importance of us continually being educated on breast cancer awareness in this subject matter. So with that being said, if you go in for a mammogram, Lisa, and they see a lesion, they see a lump, what's the next step?
Woman or man goes in for a breast image. A lump is identified. Now, the next step is really going to be determined based off of the radiologist, the physician that actually reads the mammogram. Now, based on that individual's findings or interpretation of the mammograms, if that mass or lesion is suspicious for being cancerous, a couple things may take place. One would be a recommendation that that person undergo a biopsy where an actual sample of that breast mass or lump will be removed. Second would be maybe it doesn't appear to be too much of a concern for cancers or being malignant, and additional studies may be recommended. Maybe a breast MRI would be a recommendation to further evaluate that lump or that mass. So it really just depends initially based off of the radiologist's interpretation of that mass.
Okay. All right. So that's very important to know. So if it does appear that it may be a cancerous lesion, where do we go from here?
From there, what would follow would be a biopsy to actually have a proven diagnosis. And so that person would be then recommended to undergo whether it's an ultrasound guided biopsy or MRI guided biopsy, which basically means that this is a diagnostic tool that's going to be used in order to extract that sample. Sample is returned after a couple of days, 3 to 4 days from pathology, and it's proven that it's cancer. The next step for that individual, it really just depends. Cancer treatment tends to be multidisciplinary, meaning various physicians and specialties play a part in it. So on average, a person can expect to be referred to see a breast surgical oncologist and or a breast medical oncologist for further workup and treatment evaluation.
And from my experience, at some point there may be a radiation oncologist too as well. Is that correct? Okay.
Absolutely. Absolutely. Radiation oncology oftentimes play a very important role when it comes to cancer treatment. Initially, though, it typically would be medical oncology, surgical oncology, and a lot of different factors play into part as to who you would see first. And oftentimes you may see both of these specialties around the same time of the initial diagnosis in order to develop a treatment plan.
Okay, understood. And just to touch on it briefly, Lisa, for those who may not know what a medical oncologist or surgical oncologist is, can you just briefly explain what those two disciplines are?
Yes. So a breast surgical oncologist is a trained surgeon specifically for disease or cancer of the breast. So this person's specialty, this person training is geared for breast treatment as far as surgery, right? Versus the breast medical oncologist who is trained specifically for medical management or treatment of breast cancer. So this would be the physician that would be pretty much treating the cancer from a systemic standpoint. So not just from surgery, which would be the one who removed the cancer, let's say. Medical oncology's job is to make sure that this cancer is treated or that it's maintained at a level that it does not cause symptoms or effects on daily activity, let's say, depending on the extent of the disease. And also this person is tasked for helping not to have a reoccurrence or to help with treatment recommendation to decrease the chances of a reoccurrence of this particular breast cancer.
Okay, great information for those out there who are not familiar with those two different specialty doctors. So, Lisa, once we've visited these doctors, how do they go about making their recommendations?
So the thing with cancer is there's very unique guidelines that basically help tailor when do you start treatment as far as chemotherapy or systemic therapy? When do you have surgery? Was it going to be a lumpectomy, removal of just that mass? Is it going to be a mastectomy, removal of that breast? And it all honestly depends on that individual's cancer diagnosis. Not all breast cancers are the same. Not all breast cancer treatments are the same. And the driver of what that is really the actual cancer itself. Size of cancer, the pathology or the biology of the cancer is the driver as to what type of treatment. There are some breast cancers that, because of the size of it, surgery would not be what is recommended to have first. And then the idea would be to have systemic therapy or to have medications or treatment to aid in shrinking that mass or tumor. So that way, when that person does have surgery, it's more successful. You're able to remove the tumor or remove that breast with little to no, if possible, spreading to other organs, which then leads to a better outcome, right? And there are some people that, depending on the size of their tumor, surgery is optimal first. So they can move forward and have surgery and then follow up with therapy or treatment to prevent a reoccurrence. And then we have those, unfortunately, that it has nothing to do with the size of their tumor, but just the biology of their cancer. For some who may be familiar, triple negative breast cancer, which is a high risk style of breast cancer, oftentimes found in women of African descent and heritage. And that particular tumor, because of its behavior, that particular cancer, because of the way that it behaves, systemic therapy or chemotherapy medication is usually what is the lead or what treatment will begin with first before moving on to the other disciplines in order to, again, contain that cancer in order to have a favorable outcome for that person.
I love that, favorable outcomes. And I think really from my experience in the healthcare field, the sooner that you receive a diagnosis, the better that you have a chance of having a more favorable outcome, correct? So really just stressing that importance. If you do feel a lump or if there's something that is abnormal or you go in for your routine mammogram, that right away you just need to seek medical advice on where to go and how to travel down that path so that you'll be able, right, to prevent metastasis. So I want you to explain, because there may be some people who may not understand what metastasis is. So can you just give us a little definition about what that may be?
Yeah, to simply put it, a metastasis is basically spread to other organs or other areas within the body. So a metastasis would be a cancer that is found or initially found in one organ, or it originated from one spot. And that particular cell or that particular cancer has been found outside of that area. So as an example, let's say a breast cancer that has a metastasis to the lymph nodes under the armpit, right? So meaning that that breast cancer has now traveled outside of the breast tissue and now within the lymph nodes. So metastasis is just basically a cancer that has spread to an area outside of its original starting point, let's say.
Okay. And so for someone that's asking, how will they be able to detect if a metastasis has occurred?
So when it comes to that, that is actually part of the workup when it comes to cancer treatment. Your surgeon or your breast surgeon, your breast medical oncologist have various tools that they utilize in order to assess, in order to identify whether or not a metastasis is present. That can be anything from an MRI of the breast. It can also include CT of the chest. It can also include full body PET scan. So there's various different tools that can be used to help identify whether or not a patient has a metastasis, the pathology of their tumor as well. And that is also part of the workup, whether you're seeing any one of those disciplines that we mentioned earlier. Being able to assess a risk of metastasis is part, or tends to be part, of the overall evaluation and treatment planning of a breast cancer diagnosis.
Now, as far as chemotherapy, Lisa, because really what we're trying to do this year is just really paint a picture of what it looks like once you've been diagnosed with breast cancer. So someone who's receiving chemotherapy or maybe immunotherapy treatments, what are some of the signs and symptoms that they may develop while being on these treatments?
I have to say that when it comes to chemotherapy or immunotherapy, there are so many different signs and symptoms or reactions from these treatments. And it really just depends on the medications, the actual treatment that that person is experiencing. You have chemotherapies where a person would lose their hair, but that's not all chemotherapies, right? You have treatments where people may develop neurological symptoms or pulmonary breathing symptoms. And you have medications or these chemotherapy, immunotherapies where they have a whole list of various reactions that one may have or signs and symptoms that one may have. And you'll have a person who doesn't experience not one of them. But the thing to keep in mind is when it comes to these systemic therapies and medication that's used to treat hepatitis entirely for cancer, one's medical oncologist is fully aware and fully knowledgeable on what those symptoms that a person may experience. And the way that they typically would practice is to inform and educate their patients of that so that they're aware, and also provide medications or treatment options or symptom management in order to combat that, right? So if it comes to hair loss, whether it's letting them know up front, this is what you need to expect, whether it's nausea, giving them anti-nausea medication up front so they know, hey, if you have these symptoms, here's what you can take to counteract that. Or if there's any GI or stomach issues that may come up, whether it's diarrhea or cramping, being able to educate patients of what to look out for and how to manage those symptoms. But it really just varies, honestly, Sherri, when it comes to those treatments.
Okay, thank you for that. But it really, you picture, or you gave the audience a picture of what they maybe could expect, and I love that. And you touched on something really vital, Lisa. You stated that your healthcare provider should be providing education.
Mm-hmm.
I've heard many stories where women have said, "Oh gosh, I wasn't told that," or I didn't know that. So for the audience, really, I just want you to stress again one more time the importance of selecting a provider that is going to educate you and listen to your concerns.
Yeah, that's very important. And because cancer and cancer treatment is so complex, health institutions really rely on multidisciplinary teams to be able to effectively treat, effectively care for patients, not just physically, but holistically. And so it's very important for the audience to know too that there are some information or some education that may not always come from directly from their physician, right? Oftentimes you may have like an advanced practice provider or advanced practice nurse practitioner be a part of that multidisciplinary team who may be the one that is tasked with educating the patient when it comes to their medications and their treatment. And the same may go for too that nurse navigator that may be a part of their team. They also may be tasked and are fully educated and fully capable of answering various questions pertaining to one's care. To the same, I can say, to the social worker or the chemo nurse. So I think what's also important, yes, it is absolutely important to choose a physician that one feels comfortable with, feels comfortable to be open and to ask questions, but also to choose a team, a healthcare team or a system where there are multiple layers of support there for them. So that way one doesn't put the full responsibility of answering all and every question to that medical oncologist or to that breast surgical oncologist, because I think that would be very unrealistic. But choosing a provider that has a very strong support system where you can reach out to various people and they'll be fully capable and trained to answer all concerns and questions is also equally vital.
Yes, definitely. So I'm so glad you educated us on what a multidisciplinary team consists of. So that's very important. And I'm also going to throw in that nutritionist in there too as well. So,
yes.
Right, that the audience is just aware that a multidisciplinary team is made up of several different factors, several different disciplines. And so the main goal is just to make sure we get you from point A to point Z, where now you are in remission. So what do we do when we're in remission?
Remission, that's the goal, I can say. If I have to speak for everyone, every healthcare provider, clinician, or anyone that has to take part in cancer care, that is usually the utmost goal of all of us, is to get patients who are able to get to remission to get there. And for those who won't necessarily get the label of being in remission, but to get them thriving, right?
Yeah.
And so that basically, the word remission means to be within a physical state of not having any active disease, no active cancer.
Awesome. Thank you so much for that, Lisa. And I want to take it back to now the genetic portion, which I know you specialize in that. So I want to talk a little bit about that and what that entails. Someone has family history and they're told they need to have a genetic test or some genetic testing done. What will that entail?
When it comes to genetic testing, is geared for that person who has cancer diagnosis, or in this case, we're going to be very specific to breast cancer. And it also is for that family or that person that comes from a strong family history of breast cancer. Multiple women with breast cancer, male breast cancer, so on and so forth. So what the process typically is like is you would meet with a provider, a genetics provider, whether it's a clinical genetic counselor, whether it's an advanced practice nurse practitioner or a physician assistant that's trained, such as myself, in cancer risk assessment. A consultation typically takes about 30 to 45 minutes. And that is when you would basically have a visit with that provider and they will go through a detailed family tree, detailed to the best of one's ability. Of course, I always like to tell patients, you know as much as what was told to you as far as your family history goes, right? And so after that consult, typically 1 to 2 small tubes of blood would be drawn from that patient, sent to a laboratory. And within 2 to 3 weeks, typically that person would have results that would help identify whether or not he or she has a genetic or a hereditary predisposition for certain cancers.
And so I can definitely attest to that because I went through the process and that's how I met the wonderful Miss Lisa. So I'm someone who can personally speak about it. Very painless, just a blood test. I think the most painful part is the wait.
Yeah,
The wait.
it's that anxious period of time of, okay, how long is this going to take? Said 2 to 3 weeks, but you're really hoping you're on the 2 week end of it, right?
Yes.
When you get that phone call
Yeah.
regarding your test results. Yeah.
Yeah. And so when you do finally get that phone call and your heart is racing and you finally get the results, it's a relief either way that it goes because now you're in a better position and you're more knowledgeable as to what you need to do at this point. Luckily for me, I was able to get some good news. And so now I really want to let the public know that I've been doing mammograms, ultrasounds, and breast MRI since I was 35 years old. I'm not going to tell you guys how old I am now, but I've been doing it for quite some time. And I know that I was told to get the genetic testing done some years back, but I have to keep it real because this is real talk for real life. I was nervous. I was scared. I said, well, I am getting myself checked out, having the MRIs and the ultrasounds and the mammograms every year. So I'm just going to wait on it. I'm just going to wait. But then I realized as a healthcare professional and then just as a woman in general who has responsibilities that, you know what, Lisa, I need to get this done. I need to get this done. And so went ahead and put that fear aside, which I think a lot of women have when it comes to getting tested and getting the mammograms or hearing things that may not be so true, like the mammograms, they're extremely painful. And I know it's subjective, but really I've been doing them for some time now. And I can just honestly say from my perspective that it's painless. And I don't know if you've heard that before, Lisa, if women have come to you and this is the reason why they didn't get tested or they didn't do. Have you heard that before?
Yes, I've heard that. Oh, mammograms are very painful, and I've also heard, which is more common, is that women are just nervous. They're scared. They're fearful of what the results would mean, how that's going to impact them, how it's going to change their lives. So it's really it's getting to a place where a woman feels comfortable. And it's also platforms like your platform of being able to educate women about, you know what, if I have to pick to do something fun, take a trip or go for a mammogram, absolutely, I'm going to take that trip. So is it painful to the point that it should deter you from moving forward? Probably not. But in also being honest that, it may not necessarily be the most comfortable thing to do, right? But me personally, I wouldn't put it up there on the scale of, the most pain that I've ever experienced. So it's really like just setting the expectations and just letting women know like there's a purpose or like, is it comfortable? Maybe, maybe not, depending on one's pain tolerance. But at the end of the day, it's quick, right? And that's usually what I tell women. I'm like, that long. The actual process of getting a mammogram usually doesn't take that long. And especially nowadays, you have diagnostic centers that are primarily breast specific. And I've gotten feedback from patients that they tolerate those centers maybe a little bit better. I don't know, because of machinery that they have, less discomfort, not sure. But at the end of the day, I'll tell patients and validate their fears and understand that, hey, it's not something that one would want to do, but kind of like one of those things that we have to do. And you touched on something very important when you said that as a woman who has responsibilities, you're a caretaker, you have a lot going on, a lot of people looking for you or looking to you to be able to be at your most utmost health in order to take care of them. So it's just part of all that to-do list, I would say, when it comes to getting a mammogram.
And I also look at it too, Lisa, as it's a part of self-care. It's self-care. It's self-care. It's really giving back to yourself because, again, if there is any abnormalities found and you catch it earlier, it's beneficial for you to catch it earlier than later. Your chances of survival, you increase that. So I just want to say thank you so much, Lisa, for
You're
being
welcome.
on
Thank you
Real
for
Talk.
having me.
Oh my goodness, man, you have given the audience so much great knowledge that I know they'll be able to share with others. Because remember, breast cancer affects 1 out of 8 women. 1 out of 8 women. So if you imagine you're in a room with 8 women, one of those women will be diagnosed with breast cancer at some point in her life. And so this is why it's, again, important to bring these topics such as breast cancer and breast cancer awareness to platforms like Real Talk for Real Life, or even if you go to another platform, just get the education. And that's what it's about. It's about saving lives, protecting your lives, and becoming more informed about how to make informed decisions regarding your health care. And so Miss Janice, if Miss Janice is here, she always has some words of wisdom to offer the audience or to our guest speaker. Are you there with us, Miss Janice?
I am here. No words of wisdom for your audience, but compliments to the two of you wonderful women desiring to educate the community, but really just the professionalism and the expertise that you all have in this area. I really commend you for what you do. So thank you so much for giving back to your profession and your community.
Thank you so much, Janice. I definitely appreciate it. I'm sure I'll let you speak for yourself, Miss Lisa.
Oh, no, absolutely. Thank you so much. Again, as I stated, Sherri, your platform, your organization, it's so important and so vital. Thank you for the work that you do. Thank you for just everything that you pour into giving back to women and empowering women as well.
Thank you so much. And that takes me to letting you all know that Real Talk for Real Life is being brought to you all by Women of Dynamic Change. Women of Dynamic Change is a 501c3 nonprofit. And our mission, ladies, is to break down those barriers that keep us from being able to live out full, full potential, lady. We do that through education. We do it through networking. We do it through connectivity. We do it through providing resources just to special people such as Miss Saintil, Miss Lisa Saintil. So listen, this is an organization that is really, truly genuine, wanting to see every woman succeed and whatever that means for her. We just definitely want to see every individual reach their fullest and highest potential and understand what their purpose is. And like I always tell you guys every month, all it takes is a mustard seed. That's it. Just a mustard seed of faith. I am a witness. I have a testimony that, if you cast your cares upon the Lord, he will work it out every time. And ladies, we are superheroes, okay? Once we discover what our superhero power is and when we understand how to use it, there's nothing that we won't be able to accomplish. And if we use it together in unity as women, and I call it not ex-men, but ex-women. So if we come together with our unique, because we all have unique superhero powers, and bring those powers together, the combination, it will be explosive. So thank you all for joining us today on Real Talk for Real Life. Lisa, if they want more information, is there a way, if the audience wants more information, is there a way that they can reach you, or how can they find you?
So for our audience members that do have more questions or would like to reach me directly, I would definitely direct them to you, Sherri. I know that you will always find a way to loop them back in. I am always very open and very willing to answer any questions and be willing to have any conversations with anyone on one-on-one when it comes to that.
Gosh, so appreciate you, Miss Lisa. Thank you so much. That means the world to me, because again, like I said, this organization is about seeing every woman grow, whether it be in her career, in her health, whether it be mentally, spiritually. That's what we're here for. So thank you for being a part of that. Okay. Thank you, audience, for taking the time out to be here today on Real Talk for for Real Life. And as I tell you every month, if it's God's will, you'll see me again, Sherri Ann Flanders Duncan, on Real Talk for Real Life next month. Take care, everyone. Thanks, Lisa. Bye.
Bye.